The pandemic has exposed the weaknesses of our devolved healthcare system. Looking back at those dark times, we quickly realized that no man is an island and we need to work together to improve our service delivery. Through the PGS initiation stage, we demonstrated that CLMMRH can rise above this and fulfill our mandate as an apex hospital. To attain this, we had to refresh our strategy to reflect current realities because the new normal is a world that is volatile, uncertain, complex, and ambiguous in character. I authorize our Office for Strategic Management and PGS core teams to study the health sector agenda and strategy for 2023 to 2028 and craft a development plan that reflects a clear vision of what we need to become in order to offer CLMMRH as a national resource, a shared understanding of our national purpose, a clear strategic pathway that articulates a roadmap to the future, and a mechanism for monitoring and evaluation that will allow us to pivot around barriers.
In 2015, we had our strategic planning aligned with the national objectives for health of the Department of Health. Out of total 358 deliverables that was identified, only 114 were delivered in 2020. As soon as the health sector strategy came out in September of last year, our Office of Strategic Management and PGS core team collaborated to review our strategy. One of our innovations was to extend one PGS core team of 27 people to 9 core teams of 47 people to maximize participation of units that will be critical in the execution of the strategy. It was a whole of organization approach to strategy review, which culminated in an OSM-led strategy refresh. As a team of experts with mix of skill sets, the Office of Strategic Management served as a guiding coalition that facilitated the crafting of a hospital development plan for 2023 to 2028 that is understood both by the top management and the implementing units. One of our innovations was to harmonize our hospital development plan with the basic governance documents so that it can be regularly monitored and used for operations planning and decision making. As part of our commitment to share what we have learned to our local health system, our Office of Strategic Management was invited as one of the speakers to the best practice sharing workshop for hospital development planning for level 1 and 2 hospitals in our region. Our refreshed roadmaps are now aligned with the strategic foci of the DOH strategy map. And in order to capitalize on our quality management system and the ability of our people for process thinking, we will redesign our patient care process so we can expand our services despite limitations in infrastructure and physical space, enable a competent pool of talent to meet current and future demands, especially for specialty services, invest in an enabling environment for translation of research into policy and practice, mobilize resources in order to advocate the integration of the service delivery network, prioritize key development projects for an advanced facility, guarantee excellence in our meritocracy and our human resource systems, integrate information systems that support hospital operations, nurture a culture of safety, enhance stewardship of resources. We reimagine CLMMRH as a 1,000-bed apex hospital with multi-specialty centers that will contribute to better, equitable health outcomes, responsive health systems, and financial risk protection. To share our dream of a new CLMMRH, our Office of Strategic Management posted our plans and early wins on the social media accounts of Horizon, our official publication, so that the public will know and will be aware of our strategy. We also produce several online talk shows like Ano ang Latest Marites to discuss the hospital development plan, form and function of OSM, and even prime HRM with our employees. There are no crimes against dreamers, only rewards. We have 3 cascading sessions since 2022 or last year. Our Office of Strategic Management has provided workshops and orientations about SPSMS to align individual contributions to the OPCR. But one of our biggest challenges was to harmonize the strategic contribution with the new OPCR, our incentive mechanism. Our OSM developed a framework for organizational alignment that aligns operations with the vision, mission, and strategic position. It also aligns customer focus with patient-centeredness and allocative efficiency with the medium-term expenditure framework of universal healthcare. There is a saying that goes, it takes a village to raise a child. In our journey, it takes the whole of the organization to build a hospital that we reimagine. We were able to redesign our organizational structure to develop our specialty centers. We linked the budget to the strategy to produce and procure the needed equipment of specialty centers. We also hired medical specialists to operationalize new services. As our Office of Strategic Management monitored these deliverables, the functionality score of our specialty centers have increased in a span of 12 months. The impact of creating access to the specialty centers can be seen through the increase in hemodialysis and heart station service. Now, our patients can have arthroscopy procedure and minimally invasive urologic procedures and CLMMRH. Through our partnership with the Philippine Heart Center, we made history by performing the first open heart surgery on the island. We also have sustained our closed heart and vascular surgeries since we started our PGS journey. To complement our expansion of services, we were able to maintain our residency training programs. And this includes, among others, orthopedics, which is the only program on the island, and urology, which is the only program in the region. We also started our best practice sharing and curriculum development among different departments. We sent doctors and nurses for training in various national Apex hospitals. What we are most proud of is our own in-house orthopedic nurse training that our Orthopedic Care Center organized. Through these processes, our nurses can be trained without leaving their families behind to train in Metro Manila. And finally, to ensure that the right patient will end up in the right facility, we engage our network and enable them to navigate patient to us. We develop our own patient navigation and referral system model and collaborated with the local government units and private hospitals for a pilot implementation. As we work with them, we hope that CLMMRH that we reimagine will truly serve the people of Negros.
Madamo gid nga salamat sa pagbulig kag tani padayon lang ang inyong misyon sa dire kag sa iban pa nga lugar.
By 2025, our future plans include formalizing our linkages with the healthcare provider network. By 2028, we plan to complete the construction of our infrastructure program and 11 fully functional specialty centers. By 2040, we dream to be a model organization for Philippine Health Facility Development Plan and Ambisyon Natin 2040. Together, we offer CLMMRH as a national resource that can and will contribute to national purpose and to the world as a testament the greatness of the Filipino.